Regardless of the amount of people you will still see wearing masks in public, it's been 4 years since COVID-19 spread throughout the world, and many of the things once considered fringe conspiracy theories were proven to be true. The origin of the virus being a lab leak from gain-of-function research, that lab receiving supplementary funding from the National Institute of Health, the effectiveness of lockdowns and quarantines, the efficacy of masks, the accumulating side effects of the vaccines, the opposition to proven medicines and therapeutics, and I could go on and on and on. There were so many things of which we were told to trust the experts, but it took 4 years and countless lives to prove that the experts weren't really experts at all. They were just mouthpieces for Big Pharma and the globalists, and these two are basically one and the same. Perhaps there is no greater amalgamation of globalists than the World Economic Forum, which holds its annual conference every January, and they just so happen to meet this week to discuss a number of potential problems they can solve with their money, power, and influence. Because as any historian knows, the centralization of power always leads to good things, right? Well, their top priority and panel discussion at this year's meeting was titled in the itinerary as, quote, Preparing for Disease X, which was set to be held yesterday at 11:30 Central European Time. The schedule from the WEF read the following. With fresh warnings from the World Health Organization that an unknown disease X could result in 20 times more fatalities than the coronavirus pandemic, what novel efforts are needed to prepare healthcare systems for the multiple challenges ahead? In other words, the WEF is discussing warnings from the WHO, another globalist organization, about an unknown hypothetical disease, vastly more lethal than COVID. Now, we've heard this nomenclature, disease X, before. In fact, let's wind the clocks back to 2017. At 2017's World Economic Forum, the overlords launched CEPI, the Coalition for Epidemic Preparedness Innovations, which was their global initiative to fight epidemics. The initiative was mainly focused on, you guessed it, vaccines for global emergencies. And guess who some of the investors were? The Bill and Melinda Gates Foundation, and the governments of Germany, Japan, Norway, and the United States. In fact, we donated nearly $500 million to this initiative. That means your money went there. About 3 years later, a bizarre virus started ripping its way through the Chinese city of Wuhan. That January, the World Economic Forum held its annual meeting at which CEPI, the initiative that we helped fund, established plans with Moderna to develop a vaccine. Ironically, the Moderna vaccine has become the most notorious for its adverse effects, and that's according to CDC data, not me. But there's an important point to this timeline. The forum met between January 21 and 24 in 2020, when COVID cases were just in the hundreds, and less than 100, in fact, less than 50 had died from it. And yet, somehow they knew what would come of it. And 6 days after the conference concluded, the World Health Organization declared a global health emergency. And this is, of course, when our government and politicians and media members were a little preoccupied with impeaching Donald Trump again. That next month, in February 2020, the New York Times published an opinion piece from Peter Daszak, an expert in parasitic disease, a disease ecologist, and co-founder of EcoHealth Alliance, which he founded in 2001. The piece was titled, We Knew Disease X Was Coming, It's Here Now, and the subtitle was, We Need to Stop What Drives Mass Epidemics rather than just respond to individual diseases. Well, you don't have to have a PhD to know that an epidemic or a pandemic is an unstoppable force which can only be mitigated, not prevented. Just consider, despite the lockdowns, forced vaccinations, and other global initiatives against coronavirus, the virus just about made its way through every single person on the planet. So you already know, before I read you anything from this article, that whatever he proposed in February 2020 would ultimately become unsuccessful. But it's important for today's context. Here's what Dr. Daszak said. In early 2018, during a meeting at the World Health Organization in Geneva, a group of experts I belong to coined the term Disease X. We were referring to the next pandemic, which would be caused by an unknown novel pathogen that hadn't yet entered the human population. As the world stands today on the edge of the pandemic precipice, it's worth taking a moment to consider whether COVID-19 is the disease our group was warning about. So far, you can see that Disease X was and purely is hypothetical. So shortly after we helped create CEPI, the globalists began spinning a hypothetical scenario of a global disease and how they would respond to this pretend sickness. Disease X, we said back then, would likely result from a virus originating in animals and would emerge somewhere on the planet where economic development drives people and wildlife together. Now, it is a proven fact that Dr. Daszak's EcoHealth Alliance has collaborated with the Wuhan Institute of Virology, and this makes logical sense because that is Dr. Daszak's area of expertise. But this line from the piece looks really bad 4 years later because we now know that COVID-19 specifically sprang from the concoctions of that specific lab as a result of their gain-of-function research on coronaviruses in animals. Those dots are now a little too easy to connect, but they weren't back in 2020, which makes his opinion piece look now very much like a cover-up, if you ask me. And in case you forgot, there were countless experts claiming the virus came from a market or that it had randomly or just naturally jumped from animals to people in the wild, or specifically from bats, like in a cave or something. No, it was experimentation, an intentional modification of a virus to preemptively prepare for something so deadly. And if you ask conspiracy theorists, this was biological weapons development. Either way, though, you can see the ethical dilemma that this research poses. But good old Dr. Daszak was saying, no, look over here, everyone. And the American government and media were saying, look, everyone, Trump is really bad. Just don't pay attention to anything else. Dr. Daszak said of this hypothetical illness, Disease X would probably be confused with other diseases early in the outbreak and would spread quickly and silently. Exploiting networks of human travel and trade, it would reach multiple countries and thwart containment. This connection of thwarting containment and the disease, exploiting networks of human travel and trade, shows you that preventing human contact, travel, and commerce were a central part of their plan all along. And spoiler alert, it's still their plan. Pay attention. He said, Disease X would have a mortality rate higher than a seasonal flu, but would spread as easily as the flu. It would shake financial markets even before it achieved pandemic status. In a nutshell, COVID-19 is Disease X. This was written 4 years ago, and it's as if Dr. Daszak was writing the screenplay for COVID-19 when he expressed all of this in the opinion piece. But there's that one line about financial markets that reeks of a savior kind of complex, that we must be able to do what we must do in order to save our financial markets. But what actually happened was that their strategies in prevention and mitigation were the actual disease against the markets. The lockdowns and tyrannical measures broke the backs of countless economies around the world, not to mention small businesses who were absolutely ravaged by these ensuing recommendations. And this is the veil that so many can finally see through. The globalist wants to create a one-world system. The world cannot be composed of numerous individual autonomous systems. We must have unified standards, a single currency, one governing body. For that is when all of humanity will finally achieve the nearest experience to utopianism, heaven on earth, if you will. This is what Dr. Daszak said next. The looming pandemic will challenge us in new ways as people try to evade quarantines and misinformation campaigns and conspiracy theorists ply their trade in open democracies. You see, freedom is the problem. That's the big problem. In a public health crisis, people mustn't be able to wander about and to speak freely. Therefore, anyone who speaks against us must be labeled a conspiracy theorist who's wickedly spreading misinformation. Again, this was written 4 years ago at the outset of COVID-19, so just consider how these terms and this mentality was vastly leveraged against us, we the free. Dr. Daszak said in February 2020, pandemics are on the rise, and we need to contain the process that drives them, not just the individual diseases. Plagues are not only part of our culture, they are caused by it. Again, you see, your freedom is the problem. Your humanity and your community and your fellowship and all your little friends and families, you are to blame for plagues, pandemics, and more. If you agree with this sentiment, there's only one solution: control by globalization. Yet the world's strategy for dealing with pandemics is woefully inadequate. Across the board, from politicians to the public, we treat pandemics as a disaster response issue. We wait for them to happen and hope a vaccine or drug can be developed quickly in the aftermath. In other words, we must institute these systems and processes now before disease X strikes. It can't be reactionary, it must be preemptive. Now, I would love some clarification on this. Does this mean that we develop, by gain-of-function research, numerous vaccinations which preemptively inoculate the public to supposed diseases? I mean, this is basically what we do to our children in a way with these childhood vaccinations. Or does this mean that the vaccinations are preemptively developed and they're just ready in the case of deadly diseases and viruses? Well, 4 years ago, Dr. Daszak said, discovering and sequencing them should be a priority, a simple case of know your enemy. In the aftermath of SARS, research on coronaviruses originating in bats has discovered more than 50 related viruses, some of which have the potential to infect people. This information can now be used to test for broad-action vaccines and drugs. The National Institute of Allergy and Infectious Diseases in the United States is working on a universal flu vaccine that would cover all known strains of influenza, a universal coronavirus vaccine, an Ebola virus vaccine, and others will also be needed. And I would be willing to bet our global authorities make these vaccinations an absolute requirement. Because, it's the moral thing to do. It's loving your neighbor. It's the safe thing to do in order to keep yourself and others safe. Remember all of that? Look at this next strategy. Disease surveillance should be focused on farmers, rural communities, and anyone who has extensive contact with wildlife to look for unusual illnesses, test for novel pathogens, and work with people to develop alternatives to high-risk activities such as the wildlife trade. Yes, your lower and middle class citizens will be totally receptive to surveillance. Not really, but you get the point. We have to do this in order to prevent bad things from happening. So trust us, we're the good guys here. Absolute power has never been corrupted, and there's no way that you'll find in your history books, because we've scrubbed those too. But Dr. Daszak concluded the piece with this. Pandemics are like terrorist attacks. We know roughly where they originate and what's responsible for them, but we don't know exactly when the next one will happen. They need to be handled the same way, by identifying all possible sources and dismantling those before the next pandemic strikes. As if there cannot be a more manipulative way to control people, Dr. Peter Daszak evokes our emotional connection to terrorism to strike fear in the public over potential sickness. This was written at the outset of COVID. This was written at the tail end of the development of these global health initiatives. And now here we are 4 years later, still dealing with the, quote, expertise of these global elites. And the 2024 World Economic Forum is just wrapping up in Davos, Switzerland, where they've just discussed repeated concerns for Disease X, coincidentally, as we head into an election year, just as before. Now, the World Health Director, Tedros Adhanom Ghebreyesus, you've probably seen him and heard him in the last few years. He's walking to the venue when some independent journalists bombard the man with questions that he refuses to answer.
Okay. Dr. Adhanom, do you believe that lockdown should always be rejected as a public health measure?
Can we talk later?
What time? I'm happy to arrange a meeting with you, sir. Do you believe lockdown should be rejected as a public health measure?
When do you plan on releasing Disease X? You know, Event 201 basically predicted this, well, it simulated the coronavirus pandemic before it happened, and then it came about. So, like, I've got a feeling you can't know when this Disease X is coming, which you keep talking about.
Mr. Tedros, what is Disease X?
Will you condemn vaccine mandates and lockdowns as a public health intervention?
Do you think
The World Health Organization wants actually, during the coronavirus pandemic, you changed the definition of herd immunity.
I would love to talk.
Can you tell us why? Is that?
You apologise for what you did during COVID, and should people have to go through Disease X with you now that you say it's 10 times worse?
Sir, it's a simple question. Do you condemn public health interventions like lockdowns and vaccine mandates?
The slogan for the WEF agenda this year is rebuilding trust. Surely to rebuild trust, you should answer these questions.
For its role in COVID.
Switch to side.
Yeah, we can switch sides, that's fine.
Oh my God. Dr. Tedros, this is your chance to apologise to the world for your role during COVID. Would you like to take it?
It's okay to get
Do
things
we
wrong.
have to wait for you to get everything wrong in Disease X? Do you think the vaccine mandates are wrong? You got everything from mask mandates to vaccines wrong.
Are lockdowns bad?
Do you want to apologise?
Are lockdowns a bad
Or do
thing?
we have to suffer? In Australia, we had the longest lockdowns in our city, and that was based on your advice. You don't want to apologise to Australians or anyone?
What do you say to the families of those who have lost loved ones who died as a result of all these vaccines, the likes of Pfizer, Moderna, which
What
you
about
pushed?
excess deaths? What about the current excess deaths? Do you want to talk about those? Do you take any responsibility for people who died because of the policies you pushed?
Why do scientists and doctors who oppose vaccines get silenced?
This year. Are you part of the reason why they've lost trust in the WEF and everybody's finally know who you are and what you stand for? Thank you, Dr. Tedros, for...
Do you think you'll win? And when you don't, what do you think will happen to the globalists? Well, just like the rest of them, they come here, the slogan is rebuilding trust. Yet what do they not do? They don't answer simple questions from the public. If you want to rebuild trust, my advice is that's a good place to start. When the public have questions, start answering them. And quite frankly, we need to bring back some common sense. Common sense is gone. And it's time for the people to wake up as to who these people are.
I don't necessarily agree with everything these two either claimed or questioned Tedros on, but we need more of this. More people need to speak up. More people must be questioned. More of these elites must be held accountable. These facts and the information must be shared. And as Americans, but especially as Christians, we must resist tyranny disguised as medical morality. One of the best ways you can help our show, other than by sharing the content, is by picking up some We the Free merch at wethefreeshow.com. You can be the salt and light you were meant to be by wearing the Salt and Light shirt, or by sipping your coffee from the Salt and Light mug. Or you can sport the God Bless America shirt and, of course, the classic We the Free crest tee. We've even got stickers and a Smells Like Freedom candle, that's right. So check out our new merch at wethefreeshow.com.